about we celebrate something? In the midst of a global pandemic, Black people are breaking barriers in the medical field. Recent data from the Association of American Medical Colleges indicates that applications and enrollments among Black students for medical school has risen 21% between 2020 and 2021. This is especially promising news when you take into account that Black physicians only make up 5.3% of the medical field in this country. Overall, enrollment from other non-white racial groups also rose, making it the largest and most diverse incoming class on record. So what's driving this surge in diversity? And what does this mean for the profession and the patient? We turn to Dr. Rachel Villanueva for some answers. She is the president of the National Medical Association. Good evening, Rachel. Welcome to Amplified. So start off by talking to us about some of the factors that contributed to the rise in enrollment by people of color over the last year or so.
Well, thank you for having me. I think we don't exactly know why so many students decided to choose this time. I think we can guess, and we can have a few reasons why we could think why they're doing it. I think the pandemic definitely has to play into why students are deciding to do this now. Most of the students, they think, probably wanted to come to medical school at some point. There are many students that take a gap year between college or go to work first and then to medical school, and maybe those opportunities weren't available at this time because of the pandemic. They couldn't travel. There are also some opportunities now that were not available to students before there that make fees to take things, the testing like the MCATs and the application fees are waived for more students now than they were before. And now students don't actually have to travel to apply to medical schools. Before, all of the schools you would have to go to, you would have to interview in person. And now students are able to do that remotely. And so we think that might have had something to do with it as well. So lots of reasons that we surmise.
That's interesting.
There's also some people think the Fauci effect, that everyone see Fauci as a hero, but some people think that's not really the case. I like him, so I'll put that on the list as well as a possible reason.
Look, if doctors become sexy heroes and like people all of a sudden are like, hey, I can have a really great public career doing something, awesome for the people, then so be it, right? Now, med school can obviously be very expensive, and the cost often hinders people from applying. The average student finishes school more than $200,000 in debt. So when you factor in the racial wealth gap, it's no surprise that students of color strongly consider whether to pursue a career in medicine. A Latino med student wrote an op-ed in the Boston Globe today about his struggles with paying for school, saying, quote, "When low-income students who yearn for a career in medicine struggle with how they can afford to pursue their dream, the burden is on them. But the burden should not be on them alone. We need the medical education system to ease the costs of applying to medical school and being a medical student, including paying thousands of dollars for licensing exams and the preparatory materials." He also suggested that the federal government implement new policies to make med school more affordable. So I would love to get your take on what he had to say about financial accessibility.
I think that is absolutely a real issue for communities of color. Obviously, our communities tend to have lower income families who don't necessarily have the resources or the generational wealth to be able to afford for their family members to go to medical schools. So it really is a hindrance and something that has been looked at. Some medical schools actually are actively addressing the issue, such as NYU in New York, where I practice. NYU is tuition free, and some other schools are making their medical schools more affordable or more accessible, actually, to be tuition free as well. And I think that is really where we need to go. We know medical establishments have a lot of money. They have endowments, these medical schools, and they can afford to actually pay for students to come and be educated, and we need more doctors in the workforce. We know that there's going to be a workforce shortage, and definitely communities of color need physicians that look like them. So we actually need to work not only on our increasing our workforce, but the diversity of our workforce as well.
Most black medical students attend historically black colleges and universities. When I saw that, I was like, oh, that's surprising. But then I remembered Howard and Meharry and, you know, several others. On the one hand, it shows how important these schools are. But on the other hand, it actually makes you wonder what's going on with diversity at predominantly white schools. And why do you think this is how this is all playing out?
Well, I think when we look at medical education in general, and we go back to the 1920s or 1910 when that Flexner report came out, it was a report that actually closed many of the medical schools that were black medical schools at the time. And so it closed down 5 of 7 and only left Howard and Meharry. So there are very few schools at the time that were educating black doctors. And unfortunately, that's still, even though there are more black medical schools today, there are many diversity initiatives at majority schools, we still know that the segregated system, the structural inequities that existed back when Jim Crow laws existed, really kind of paved the way and have set what is now our issue as far as decreased numbers of African Americans in medicine. I mean, 5% is a really abysmal number considering we're 14% of the population. And when you think in the 1920s, right, at that time, it was about 2.5%. So we really haven't in a century made much headway in the diversity of medical education.
My goodness. Diversifying the medical field is equally important to patients and those who seek medical attention. We've brought this topic up on the show several times and earlier this week, but there's research out there that says that black patients might have less pain and anxiety when treated by a black physician. So can you explain the importance of diversity for the medical professional and also the way it translates to the patient?
It's really so important. COVID has highlighted the disparities that exist in our healthcare system. And we know that patients of color do better when treated by physicians that look like them. That's been well researched and documented, from heart issues with black men to infant mortality. Black infants die at a lower rate when they're treated by black doctors. So we can't underestimate the importance of diversifying our workforce and to continue to do that. I mean, this sort of bump that we have this year, I think, unfortunately, won't last. I think they've looked at the numbers already for the following year, and they're kind of more like the pre-pandemic numbers. And so we really do need to make more of a concerted effort, not only to educate black doctors, but to take care of black patients and to make sure that patients feel comfortable and supported and feel that as though the healthcare system is working for them and not against them.
Dr. Rachel Villanueva, thank you so much for your time and for breaking all of this down for us. I'm so glad we got to have you on.